Hi, I'm Cindy Cantrell, and this is Compassionate Journeys, conversations about home care and hospice presented by Home Health Foundation. So it seems safe to say the COVID-19 vaccine distribution has been met with both great excitement and some wariness, which is why we're here today. I'm joined by Dr. Bernice Burkharth, Chief Medical Officer at Home Health Foundation, who's going to set us straight. Dr. Burkharth, thanks so much for being here and sharing your expertise.
My pleasure.
There is a lot of great excitement about the vaccines, and there is also a lot of great trepidation about the vaccines. So I'm very excited that you're here to kind of give us the real information, what we really need to know. I've compiled a lot of questions that have been submitted to us both by employees and also just in general that I've researched. And thank you for providing your expertise.
It's my pleasure.
So I understand that the Pfizer and the Moderna vaccines are mRNA vaccines. And how does that work, please?
Okay, so mRNA is messenger RNA, and basically it's a set of instructions. It goes into the cell, and it teaches the cell, or tells the cell, hey, follow these instructions and make this piece of a protein, a similar protein like the COVID-19 infection or SARS-CoV-2 virus, right, has this distinctive protein that allows it to get into the cell. So we teach our cells with the messenger RNA, with the instructions to go ahead and make that a portion of that spike protein so that our bodies see, our cells see that this protein is there, and they understand that it's foreign to them. They don't, where did you come from, spike protein? Mm-hmm. And so they develop, as they should, an immune response to that spike protein. And what's nice about the mRNA is that when it's done, it degrades. It's supposed to be within hours to days. Once it's done its job, it degrades, and the protein itself remains to allow for that buildup to happen, and it also goes away. And then when your body is faced with the SARS-CoV-2 virus, which is the mediator of COVID-19, it says, "Oh, I know you. You're a stranger to us. We've developed a response to you before. Here it is now." And so the body can fight against the impending, infection as it comes to.
Okay. So I know some people don't have a choice of vaccine, and some organizations are getting one or the other, but is one better than the other, or what is the difference between the two?
And so when we're talking about the two vaccines, we're talking about the Pfizer vaccine, yes, right, and the Moderna vaccine. Yes. And they're both very, very similar. They're both messenger RNA mediated vaccines, right, with the description that I just gave. And they have essentially the same efficacy and safety profiles, both the Pfizer and the Moderna. Which is about 95% or 94.5%, right, efficacy. Neither of them had reported serious adverse reactions. And the main difference between them is the time between doses. Okay. So that the Pfizer vaccine is the one that you get 21 days apart, and the Moderna vaccine is the one that you get 28 days apart. There are some differences in handling, and I guess that would be important for people to understand in terms of how the vaccine is processed through the system. The Pfizer vaccine has a cold component that's required with, I don't know if you paid in the news with the special freezers that they yes. needed for the Pfizer vaccine because of the cold that's required to maintain that vaccine. Where the Moderna doesn't have the same cold requirements that the Pfizer does, although it does require refrigeration, obviously, before transport to be able to provide and administer. Okay. But the main difference is the differences between the times you get the first and the second vaccination shots for the vaccines.
Okay. So, a very popular question, can an individual get COVID-19 from a vaccine?
No.
Okay.
No. You can't develop the infection from the vaccine. You can't get the virus from the vaccine. You won't get a false positive
Okay.
result on a COVID test from the vaccine that's looking at either PCR or antigen testing, right? Those are the tests for active infection. So those will not come up positive after you've received a vaccine solely by virtue of having had the vaccine. If it's positive, it's because you likely have an infection with COVID-19. The messenger RNA does not enter into the DNA, the nucleus of our cells. And there's no vaccine, there's no virus in these vaccines. There's no
Okay.
piece of the virus, no virus.
Okay. That's comforting.
Yes.
I know that every state has its own plan regarding the distribution and who is eligible at what time, and that is very complex and very specific. But in general, who do you recommend should receive the vaccine?
Anyone who is eligible to receive the vaccine should receive the vaccine.
Okay.
They don't have final answers on the pediatric population. That wasn't studied.
Sure.
Right. But anyone who is 18 and over for certain and should receive the vaccine. And then that age group that was in question, the 16 to and 17-year-olds, should speak to their pediatrician, see if they are eligible and can receive the vaccine. So anyone who's eligible
Okay.
should be receiving this vaccine.
Okay. And what about pregnant women or women who are planning or hoping to become pregnant?
So interestingly, the recommendation now is yes, they should go ahead and obtain the vaccine after discussion with their OB, their
Okay.
obstetrician. The pregnant women weren't tested or included as part of the studies for the vaccines, which is standard.
Okay.
When you're first processing through, that population is not necessarily included in the standard trials for vaccines. However, there were people who became pregnant before the first and second shots of the vaccine, and so it's a very small number of individuals. However, the feeling is, and why the recommendation is yes, is that there is a risk for severe COVID infection in pregnant women, and if you have severe COVID, the risks of that outweigh the benefits that you will have from the protection of the vaccine.
I see. Okay. Is there reason to believe that the vaccine affects the safety of breast milk?
No,
Okay.
in fact, they've said you can go on and continue to breastfeed. You don't need to stop
Okay.
because of that.
So I think there's a perception that these vaccines were developed extremely quickly, and then they were approved, by emergency order.
Right.
And so there perhaps is a bit of skepticism or a bit of wariness, like, are they really safe? And for some people, it's a wait and see. I'm going to wait and see what happens to this first round of people, because I think now, as I looked at the Washington Post statistics, it seemed about 1.5% of the population has been vaccinated to date, which is still very small, but yet obviously the country's trying to roll it out very quickly.
Perfectly understandable concerns. Certainly, I actually posted myself about how I was one of those people.
Yes.
At the outset of this, back in March or April, when that was even a thought, oh, maybe this will happen, a vaccine. I was thinking at that time, well, I'll just have to wait and see.
Yeah.
But a lot of information has come out about the development of the mRNA, for instance, as a vehicle for vaccine development. And that technique has been studied and prepared for quite some time, at least a decade, and had been utilized or attempted to be utilized for other vaccines. And I think one of them, the vaccine was prepared but not needed by the time that it was ready to go. So one thing is this technique, which is the new technique that everybody's so excited about, is not necessarily new.
I see.
Right. The other thing is, when they talk about, wow, this was expedited, a lot of the safety measures were not expedited, and there were still the phases of trials that they went through to get the vaccine where it needed to be. My understanding is a lot of those were also done concurrently, so it didn't take as much time. That
Yeah.
was one of the measures they used to try and fast track, if you will, or facilitate or expedite getting this vaccine to us sooner. The other piece of it is they study the safety profile, and they look, and when you look at the number of people, there were over 30,000 for one of the vaccines and 43,000, I think, for the other of the two vaccines that we're speaking of, the Moderna and the Pfizer. So they did test a significant number of people to be able to come to this safety profile that they have arrived to now. So I feel fairly safe and confident
Okay.
in having had the vaccine.
Yeah.
So, and I recommend it to my family, to my friend, to anyone who will listen.
Yeah.
If you have a question, there are reliable sources. You can ask your physician first, always, right? Your PCP, the CDC website. For those of us who work at HHF, the HHF website, the WellForce website, all have FAQs that address any questions or concerns you may have about the virus. About the vaccine.
Sure.
Of course.
I'm glad that you brought up that you got it, actually, because that was one of my questions. I had known about that before. And since it has been approved by emergency, we're not required to get it.
Correct.
And so I was kind of curious, why you decided to do it, because you didn't have to. And some people, even under the best of intentions, don't get the flu shot, even though they mean to get it. So you probably had to, really seek it out a bit and go to a bit of effort to do it. So why?
Yes, a couple of reasons. One is I'm patient-facing, meaning that I, care for patients.
Yeah.
And also because I work and live with other people.
Yeah.
Right? And I'm not trying to be flip. It's just that, I believe and have done the reading, so it's not a random belief. It's an evidence-based belief that this is an effective tool in trying to fight this pandemic that's happening all around us. And, the numbers are astounding.
Yeah.
I think each individual pocket, once we get out of our crisis point, right, whether it's New York or in the Boston area or, we see what's happening in California, when that ebbs a little bit, or becomes our new normal, I think we forget about the national and global numbers of people that have been affected by the virus and that have died because of the virus.
Yeah.
So certainly when there's a tool available that is safe, that is effective in preventing the virus and or preventing the severity of illness that can be borne by the virus, then yes, I'm going to do everything in my power to protect myself in that way. And if it will help also the bigger picture of arriving at that herd immunity so we all can get to that point, then yeah, I'm going to do my part as well. So,
would you mind talking about your experiences? Because
absolutely.
People are so, we all hear so much, and actually some of the most common questions are, how do you feel?
Yeah.
Would you talk about your experiences with the first and then the second dose?
Absolutely. So the first dose, I was pretty good going into the first dose because I had, done the research and felt, this is safe and the right thing to do, so I'm ready.
Yeah.
And I had my vaccine. It went very well. It was efficiently run, the organization where I got it done. And I had a little bit of pain at the site, at the injection site. I always use my non-dominant arm just in case, right?
Yeah.
So use my left side. And it was sore afterwards. Now, I had the pleasure of having to have a tetanus booster last year, and still remember how sore my arm was. And so this did not approach that kind of soreness.
Yeah.
No offense to the tetanus booster people.
Yeah.
So it was sore. It was not as sore as it was with the tetanus booster.
I remember my tetanus booster too.
If you just don't forget that.
No.
And, you know, I did not take anything for the soreness. I did not, I figured that it was normal.
Yeah.
An expected,
Yeah.
even, side effect at the injection site. And by the next day, it was fine. I was able to lift and use my arm without difficulty, and I didn't really have any soreness. I never developed a fever
Yeah.
or body aches or chills. That
Okay.
you know, you've heard tell
Yes.
of the side effects that can
Sure.
happen. So that was my first vaccine. I posted about it. I was like, hey, it was all right, and this is what happened.
Yeah.
So my second shot, I went in, and I was more anxious than I was for the first.
Why is that?
Because the science was already sorted, but I had been hearing reports about how, well, the second shot, whoa, that's when it happens, you know? And so I was a little anxious, you know, and I went in and I happened to know the person who was giving me the shot, which was nice because
Yeah.
it was perfect. And you're right. I said, I'm a little more anxious for this one than I was for the last. She goes, why? Well, and she goes, no, it'll be fine. And then, you know, I didn't have my phone up in time before she was like all done. I was like, wait, selfie. So it went very smoothly.
Yeah.
And when I went home, my arm was sore, as I had anticipated, and I was like kind of almost waiting.
Right.
Like, am I feeling something? Am I having? But no. Again, I was very fortunate. I had a little more soreness. Still did not approach the tetanus booster level of
Okay.
soreness. And again, no fever, no body aches, no chills, no fatigue.
Nothing. Wow.
Nothing. Very, very fortunate. You know, I've talked to other, and then I've been fine since then.
Okay. How
And then-
long ago was your second dose?
Probably 2 weeks now.
Oh, okay. It's a while, yeah.
I'm trying to make, I can't remember off the top of my head.
That's okay.
But yeah, probably around 2 weeks now. So, I've talked to other people who
Yeah.
have had a variety of the
Yes.
side effects that I
It
mentioned.
seems to affect lots of people in lots of different ways.
Yep. And the second dose has been where people have reported more of the symptoms. Which
So why is that? Is
Yeah.
the second dose different?
no, it's the
Okay.
same. It's the same medicine.
Okay.
The way I've read it described is, you know, the first one's kind of your primer,
Yeah.
same medicine. The second one is your boost to bring you over the edge, right? And so it makes sense that your body is responding as it normally would, kind of fighting back a little bit. So you see a little bit of that response in the mounting of a fever,
I
or
see.
you know, the body's reaction with the chills or the aches and the fatigue. So those are the most common side effects that you see, and again at the injection site,
Yeah.
right? The soreness in the arm, as I mentioned, and the reason it does make sense is that your body's kind of mounting that response, a little response to
Yeah.
this. So it makes sense that you would have a more prevalent or more prominent on the second dose showing of those. Actually, I was a little worried that I didn't have more.
Interesting.
But you know, I guess I just worry all the time. But I'm good. I'm good. And it went fine. So again, very fortunate, and had minimal, if any, just the arm soreness.
Yeah. That
And
seems manageable.
yeah, and even the folks that I've talked to that have had the other symptoms, it's been manageable. Some of them planned for it,
Yeah.
and not, you know, anticipated that it was possible.
Sure.
So, and I did. When I took my first vaccine shot, I was on a day off, and it was prior to a weekend.
Yes.
So I was going to be off, and then this time was also like heading into a weekend, so I knew I'd have those next 2 days if I needed to
Yeah.
recover.
Yeah. When I went for my vaccine, the woman who gave it to me was very nice, and she said, you know, oh, drink a lot of water. And I said, oh, don't worry. I said, I'm not going to work out or anything. And she said, oh, no, you can. And I said, no, you were supposed to tell me that I can't.
Don't you hate when that doesn't work
You were
out?
supposed to tell me to sit on the couch all day.
That's right. That's right.
Yeah. So do you think that there is, so I would never personally do this, but because I had heard about the side effects that were coming with the second, and I joke that I would never do this, but I was a little anxious as well with my second,
Sure.
thinking like, well, I'm probably good with my first. Like,
Oh, yeah.
you know,
So a couple of things. Yeah, no, that's a good question. And a lot of people have brought it up.
yeah, okay. So what do you tell people? Like, they really need to get their second.
No, you need to
And
get your
why?
second shot. You need to get your second shot.
Is there any protection with the first, and how much more effective is it with the second?
There is some protection with
Yeah.
the first. However, there are a couple of issues with that.
Okay.
One of them
Let's hear
is
it.
it may shorten the length of immunity that you have,
Oh.
right? If you only do one. And then the second one brings you over that edge and brings you up to that 95%
Yeah.
efficacy, right? And the 100% I think is for decreasing the severity of the illness. So you don't get there until you've had, in fact, the full immunity comes 2 weeks after the second shot.
Okay.
The recommendation from our CDC is
Sure.
to get both shots. Part of the other reason is that's how they were studied,
Okay.
right? They were studied 2 shots, Pfizer 21 days apart, Moderna 28 days apart, and we know that they work to the level that they work at based on that schedule.
Okay.
And so the recommendation is to follow that schedule and to get your second shot
Okay.
as close as possible to that 21 days for the Pfizer and the 28 days
Okay.
for the Moderna. So please, yes, everybody get your second shot.
Okay. Should people do anything preventative going into the second shot? Should they, for example, oh, I know my arm's going to hurt, so I'm going to take ibuprofen beforehand,
Sure.
or not so much?
The recommendation at this point is not to take Tylenol, ibuprofen, or an agent like that prior to the injection of the
Okay.
vaccine. There is concern that it may interfere with the immune response
Oh.
setup. They say that you may take something afterwards if you need it for the relief, but beforehand they recommend that you do not take anything prophylactically or in
Okay.
anticipation of
Okay.
those symptoms.
Good to know. Are we going to need an annual COVID vaccine like we get an annual flu vaccine?
Yeah, a lot of people have been asking that as well.
Yeah.
At this point, I believe it's really too early to see what the length of immunity and when that immunity will wane in vaccinated individuals. It appears that, it's too early to tell.
Okay.
I'm not going to speculate.
Okay.
Because
You
that's
don't
what
have
we're
to.
trying to avoid, right? Speculation. So I'm
Yeah,
not going
yeah.
to speculate.
Okay.
At this time, it's too early, and they're looking at how long the immunity is conferred, and when it starts to wane before they can do that.
Okay. So this question might also lead you down a speculation path, but I'm curious if people who have had the vaccine and then become infected with COVID, are they believed to become less ill?
In fact, yes.
Okay.
Yes.
Oh, okay, good.
They've done based on that clinical trial data that they've looked at. The expectation is that if you've been vaccinated and you do acquire the COVID-19 infection, it will be less severe than if you hadn't had the vaccination in the first place. And that's not unusual. We see that with flu. Some people still get flu. They just don't get it to the extent that they would if they weren't protected.
Okay.
So that's another good reason for getting the vaccination.
Okay. Something else that people are concerned about, obviously, are allergic reactions. And I'm allergic to a couple different medications, so I was initially wary, but I was reassured that that had nothing to do with the vaccine whatsoever.
Right, and if you go through some of the FAQs on the
Yeah.
CDC or on some of the sites that I mentioned, they actually almost go through by medication category,
Yeah.
almost, because everybody has a different
Yeah.
medicine that they're using or concern. The big picture
Yeah.
is that medication allergies in general, immunocompromised states, other illnesses aren't really contraindications to the vaccine. There is a category of people that need to be wary, and those are the individuals who have an allergy to a component in the vaccine or an agent in the prep which is a component of the vaccine,
Okay.
very specifically. And for that, I recommend that you actually go and look at the listed
Okay.
ingredients of the vaccine. I don't want to get the names wrong.
Sure.
But for that specific group of people who have an allergy to a component of the vaccine, and they typically will list it for you so you know.
Okay.
And if you do have that allergy, then you should speak to your allergist.
Okay.
Always, I guess, start with your PCP, your primary care provider, and if you have an allergist, then speak to your allergist about it.
Okay. When we get the vaccine, why do we need to continue wearing masks, social distancing, performing hand hygiene,
Sure.
and all the rest?
Yeah. Well, it's funny. That one comes up all the time.
Right.
And the truth of the matter is well, there are a couple of pieces to this. One is the vaccine is one of the tools that we have in our toolkit now to deal with this pandemic,
Okay.
right? To deal with this COVID-19 pandemic.
Yeah.
And the best tools we have are the masking, universal masking, hand hygiene, right? Social distancing. We know those work. And so that's super important to continue to do, because the vaccine, you can still get COVID-19. You'll get less severe of an infection, of course, but you may still get it. It's not 100% effective against getting the vaccine. Remember, that was at 94.5
Yes.
or 95%. There's still a small percentage of people that could get it. The other piece of it is the transmissibility is not clear yet.
Okay.
So if you've been vaccinated, but you get COVID-19 so minimally that you don't know you have it, it's unclear whether or not you can still transmit that to somebody else. So it's another reason to keep, right? The masks are for other people,
Right.
right? The
Yes.
hand hygiene is kind of for us and for them.
Yeah.
And social distance for everybody.
Yeah.
So that's one of the kind of very important reasons. And the third reason, I think this is three, right, is the development of herd immunity.
Yeah. Tell us about that.
So it
When
used
does that happen?
It started off as a dirty word, right? Because before the vaccine, it was like, well, we're not going to do that. That means that a lot of people get sick.
Absolutely.
We want to avoid that.
Yeah.
Because of the severity of illness and the potential for, death. Quite honestly, with this
Yes.
infection. So, it's estimated that about 60 to 70% of the population needs to achieve immunity through either vaccination, preferably, right, or
Yeah.
illness, to achieve that herd immunity where we're all kind of group protected.
Okay.
Which is the last piece of that, we're not there yet. You mentioned 1.5%.
Yeah, we have a ways to go.
We have a ways to go. So, yes, everybody needs to get vaccinated.
Okay.
Yeah.
So if someone overhears something or reads something on social media that raises a question in their mind, you mentioned before a list of great places to go for accurate information, and homehealthfoundation.org is one of them, fortunately. I think it's worth repeating if you don't mind.
Yeah, absolutely.
The places that people can go for reliable, accurate information. Aside
Absolutely.
from this awesome podcast.
That's right. That's right. So the CDC,
Yeah.
always Mass DPH.
Yeah.
Their site is, both sites are. When you get to the COVID piece, it's fairly easier to navigate than I imagine other sites are. I don't know, maybe I'm just proud. The CDC, mass.gov, and Mass DPH, Home Health Foundation
Yeah.
website, the WellForce website, as I mentioned, has a FAQ available as well. A lot of hospitals, your local hospital will likely have an FAQ website, on their website rather, an FAQ site, or frequently asked questions.
Yeah.
Sorry, using shortcuts here. Your PCP is always a good and trusted source, and they have access to all of these resources as well. And these sites have resources in multiple languages, in different formats, so that it's understandable to hopefully all and anyone who needs access to this information. So those are great, reliable sources that one can kind of reach back to and double check and ask questions. And they respond too if you send in a question.
Yeah.
So I know that Mass DPH, I've emailed them and asked them a question. They've responded. So,
Oh, that's great to know.
yep.
Well, thank you very much for your time today. I know that you've come from our High Point house, which is our hospice residence, and we do have a COVID pod there for patients. So I just want to thank you very much for your time. Is there anything that we didn't discuss that we should have, or anything that you want to add?
Get your vaccine.
Yeah.
And continue to mask, right? Hand hygiene, social distancing. We this is what we have to do, and we know that these relatively simple measures, in addition to the vaccine, work.
Yeah.
So keep doing that.
Yeah. Well, thank you so much for coming, Bernice.
My pleasure.
Appreciate your time, and thank you for joining us today.